Good afternoon and welcome to Oceanside Library's virtual program. This program today is sponsored by Assemblywoman Missy Miller and Northwell Health. We are so glad to have Dr. Gittleman with us today, presenting us this wonderful presentation on strategies for living with chronic pain. We thank you so much for joining us today. Take it away.
Thanks so much for having me, and thanks again for everybody's patience. Today, I'm going to talk about a topic that I think is very relevant. We know that chronic pain afflicts many, many people, and unfortunately, more and more people these days. So I'm hoping that in this presentation, I'll give you a little bit of an introduction to a way of thinking about chronic pain using some metaphor, talk about some of the ways that pain can influence multiple areas of our lives, and then get down to talking about some strategies that I hope will give you some tools for how to manage life with chronic pain. I'm hoping also, even though we're going to be cut a little bit short, I'll leave some time afterwards for question and answers. And I know in the last presentation I had given in the library, if there's any questions we don't get to, I'm happy to provide contact information so you could reach out afterwards. So I like to start with this cartoon because for any of you who are experiencing chronic pain, I know that this is how it often feels. Aside from the physical aspects of the pain, to have pain that lasts for months or years leaves you with these feelings of desperation, of fear, of helplessness, of not being sure how you're going to get to live any kind of quality of life. And these are some of the quotes that certainly I hear from my patients who are coming with chronic pain, and I think that you probably know this experience very well. You also may have had the experience that not only do you have your own distress around chronic pain, but unfortunately, some people have had the experiences of going to different encounters with different clinicians and feeling like they're met with some resistance or some negativity from the clinicians. And so, it seems this curious thing. You're going to people for help and sometimes being met with a negative attitude or a stigma. And so we ask the question, why does chronic pain create this kind of reaction in people? And the way that I understand it is that I think pain is so complex that it creates distress in all of us. And it's complex for many reasons. It's complex because there's so many factors that can account for how a person experiences pain. We can have two people that have the exact same report of pain in the same area, of the same intensity, of the same quality, and then you x-ray that part of that person's body and they have drastically different anatomy, right? And then on the flip side, you can do MRIs of two people's spines and have almost identical MRIs and have very, very different reports of the pain, right? So we know that there's so many different things that factor into the experience of pain. The other very complicated nature of pain is that it's completely subjective, right? We can MRI a spine or do X-ray or imaging, and we could do a full neuro exam to try to get a better sense of what's going on, but there is no test to date that we can do that says, yes, you have a pain that's a 10, right? Or you have a pain that's a 2. So we are, as clinicians, completely dependent on the patient's report of the pain, and a patient is also, completely responsible for their own account of the pain. And so it makes it a really complicated thing, and it automatically means that the treatment of pain is going to have to be more complex. We're going to have to tackle it from different angles, and it's going to have to be a collaborative process. This is a metaphor that a former supervisor of mine had created that I really love, that I think characterizes the experience of chronic pain. And what she said is that developing chronic pain is like you're driving along in your car on the journey of life, and you're going whatever speed you want, taking whatever turns you want, controlling the wheel however you want. One day you pull over at a rest stop and you get out of the car, stretch your legs a little bit, and when you get back in the car, there's a person sitting in the car. You don't know them. You don't know why they're there. They don't explain it to you. They don't tell you what they're doing there. They just look at you and say, I'm here for the rest of the ride. And I think if you could imagine that scenario and how bizarre that seems, I think for any of you that have chronic pain, that's what the beginning of developing chronic pain felt like. And you could imagine that the beginning parts of this would be to try everything you can do to try to fight against that passenger. Get out of the car. What are you doing here? It might create a lot of anger. You might do whatever you can, reaching for every resource. In the chronic pain world, we know that when a person first develops chronic pain, they often go to multiple specialists trying to get answers, running tests, trying to figure out what's going on. And unfortunately, for many people, the end of the line is not an answer and a cure. The end of the line is just the realization that this person is going to be there for the rest of the ride. And what I love about this metaphor is not only, I think, does it really exemplify what it's like to experience this chronic pain and how overwhelming and consuming it could be, but it also sets up a nice metaphor for how we can think about trying to work with our chronic pain. And what I tell patients when I'm working with them is that my goal is not to cure their pain. I wish I could. But my goal is to try to give them control of the wheel again. That if right now when they come to me, or for some of you, it might feel like the pain is behind the wheel, dictating where you go, controlling your life, right? With some of the strategies that we'll talk about today and some of the strategies that I work with patients, the goal is get the passenger in the back seat and get you back behind the wheel, dictating where you're going to go. And I say in an ideal world, we even sometimes get the passenger in the trunk to where you barely notice them anymore. So they're there, but they're really in the background. This is another diagram that I think captures that complexity of pain, but also, as I mentioned at the very beginning, the way in which pain is not just a unidimensional kind of thing, right? Pain is something that not only affects us physically, but it also affects pretty much every aspect of our lives. And so we know that people often get into these spirals where once they develop the pain, then they end up experiencing a decline in their functionality, and sometimes to the extent of having to be disabled. They might stop working and have less income. They might also stop moving and doing as much physically, so then their whole body becomes deconditioned. Then with the deconditioning and not working and not being as engaged to people, they might experience social isolation and depression. And then unfortunately, all of those things, isolation, depression, anxiety, all exacerbate pain. And so you end up being kind of in this vicious cycle and this negative spiral where the emotions fuel the pain fuels the disconnection from life, and you kind of end up in that spiral. The good news is that with some of these strategies that we'll talk about, you can stop that spiral and reverse it. So you can learn new ways to adapt. You can increase functionality with certain approaches and adaptations in mind. You can shift your approach so that you can still remain connected to people and decrease that sense of isolation. You can treat the depression and anxiety, and all of a sudden you have less triggers for your pain. Mood starts improving, functionality starts improving, and now the spiral's reversing. So what are the tools that I'm kind of referring to, and what are the different things that we know we can use for pain? Well, the ones in this slide I think are the ones that you probably are most aware of. Obviously, medication is something that's talked widely about. Opiates have gotten a lot of press, and primarily negative press. Unfortunately, opiates can be a really good treatment for chronic pain, but sometimes have negative consequences. And so, I think that the negative press has colored it so poorly that it's limited the access to these medications that for some people have been really helpful. So, being in pain management, we still think of that as an option. It's just an option that we have to be really cautious around. We have to make sure that there's not a history of addiction, there's not a tendency towards that, and that we have to also be monitoring how the person is using the medication so they don't get into that realm of overuse, of misuse of the medication. We also know that there's been a real big push because of all the negativity around opiates for non-opiate pain medications, and we're hoping that more and more will evolve. But we do have a number of different classes of drugs that can be used to help decrease pain. There's interventions. My colleague who's here, who's an anesthesiologist, he knows a lot, and I'm sure could do a whole talk on the various interventions that we can use for pain. That's injections, epidurals, procedures, surgeries. These are a number of things that can be helpful in managing chronic pain. There's this therapy. So there's physical therapy, occupational therapy, some of the complementary alternative therapies, yoga, Reiki, massage, um, and psychotherapy is certainly another formal approach to this. And then what we'll spend the bulk of the talk on is more of the behavioral approaches and the psychological approaches that don't require a therapist to be involved. Um, Before we get into the way to the approaches that you can use, a concept that I think is really crucial to understand when you're working with pain is this concept of locus of control, which is how you understand the consequences of your behavior and how you understand your role in being able to change your experience of your life. And if you have a primarily external locus of control, you believe that your experiences in life really happen to you. Things happen to you, and you don't have the ability to execute control over your life. Kind of the notion of the consequences of my behavior are outside of my control. And so, this is a person who might feel victim to their pain and also be approaching doctors, specialists with the notion of what can you do to help me with my pain? And I get it, living with pain is no easy task. And I wish there were just things that we could give to people to help them feel better. But what we know in the chronic pain world is that the things that are going to help people get better require their effort and require their acting on these things. And so what we want to do is shift people to more of an internal locus of control where they realize even if the pain debilitates them to some extent, they still have the ability to control certain aspects of their life and to control their experiences. And once you believe in that, right? Once you have this notion of, okay, I might not be able to change pain, but I can change how I interact with my environment. I could change how often I'm going to engage with friends. I'm going to change how often I engage in meditation. And that might help my quality of life. Then the rest is history, right? Then it's just about trying these different approaches. But this shift is really a crucial one to make. In making this shift, this is kind of a key way to do this. You shift from the question of it's not how did I get the pain, it's how do I manage the pain. It's not what's the cause of the pain, it's what might influence my pain. And this is the big one. It's not what can others do to help me, it's what can I do to help myself through this. So the first thing, and this is probably the first thing in any kind of self-help, is education. You know, making sure that you educate yourself on what is chronic pain, how is it different from acute pain. Certainly, you know, we know the basic difference is, in acute versus chronic is the length of time you've been experiencing it. Acute pain is anything, I think at this point in the definitions, you could correct me if I'm wrong, I think it's up to 3 months, and then I believe 3 months and beyond is considered chronic pain. So part of it is just the length of time you've experienced it. But the really important distinction that I think is important to make is acute pain is adaptive. It is something that is really necessary for us to experience in order to protect ourselves. You accidentally put your hand on a hot stove, immediately you have that acute pain reaction, you pull your hand off the stove, it protects you, right? So you experience some of the tissue damage, it hurts, you move, you react, and you protect yourself from having a worse burn. Chronic pain is no longer adaptive because with chronic pain, the signals are firing even though there might not be ongoing tissue damage. And so you're getting the signals that you need to do something or you need to act or you need to try to protect yourself, and yet there's nothing to protect yourself from. The metaphor we use here, it's like if the fire alarm in your house was going off and it was ringing, it's ringing, it's ringing, of course the fire company comes, right? The fire department comes, they check the whole house, they clear out the house, and they look around and they say, no fire, must have been just a faulty alarm. Hope everything's okay, we're gonna go back. They go back, fire alarm rings again. They come back, same thing. They say, you know what? This happens sometimes. We don't exactly know why. You can try to check the alarm, you could check your house, but there's no fire here, everything's okay. The fire department leaves, the people check the fire alarm, they check the batteries, they check the house, and no matter what they do, they can't get that alarm to stop going off. The fire department stopped coming because there's no fire, but that alarm just keeps going off and off and off. You could see clearly it's not adaptive. You could also imagine how crazy making it could be, but it's something that requires a shift in the way of thinking and a shift in the approach to it. The other key piece of educating yourself is also educating yourself about your specific pain. So not just educating yourself about pain in general or this concept of locus of control, but it's also about trying to, so often when you have pain, I have so many people who say like, I just don't want to talk about it. I spend so much time living it. I don't want to talk about it. And I get that. But you do have to try to understand your pain. The more that you can know, for instance, about certain triggers, certain things that might help your pain, certain things that might hurt your pain, certain times of day where the pain might be worse and days where the pain might be better, things like weather. It's helpful to know that so that as you're working on building up these tools that we're going to talk about, you can, the more that you know, the more you can implement the tools in a way that will be ideally successful. So over here, the purple paper, I know it's sideways, but that's just a sample of a pain diary. I have tons of those, and if you Google pain diary online, you'll see tons of different examples. I tell people, go with one that feels the most doable for you. Some people like a very simplistic one, some people like to keep their own record, but some way of trying to get acquainted with your pain in a consistent way for a set period of time. You don't have to do it indefinitely. I usually tell people try to do it for 1 to 2 weeks so that you really capture the full range of your pain and just acquaint yourself with it. Another tool that is hugely important outside of education is goal setting. And I like to often start out with that one because ideally one of the first goals you're going to start with is maybe educating yourself or the goal of taking on one of these tools. And so setting goals can be incredibly helpful because as much as they seem kind of simplistic and overly concrete, when you live with chronic pain, it's one of the first things that flies out the window. I have so many people who tell me, I stopped seeing friends, I stopped exercising because what's the point? It hurts when I do that. And I can't make plans with friends because half the time I'm in such pain that I have to cancel. So what's the point in making plans? And so all of a sudden, like that spiral showed, the functionality declines and the quality of life declines. So in order to stop that spiral and reverse the spiral, we have to begin to set goals, and they could be tiny goals. This SMART goals approach, it's an acronym, is setting goals that are specific. So you have, instead of just saying, I want to do better, I want to do more, I want to exercise more, you try to set the goal in a specific way. You try to have it be measurable. So I would like to exercise, I would like to start exercising 2 days a week. And I would like to exercise for 30 minutes a day. You want it to be something that's achievable. Set it realistically. So maybe I said 30 minutes. If you haven't been exercising for 2 years, you may set it at 5 minutes, 2 days a week, right? So you want it to be realistic. You want it to be something that is timely. I want this to be done by 2 weeks from now, so that there's some accountability and a direction to your goal. We're much more likely to achieve goals and to make progress and to stay motivated if we set goals in this type of a way. Another tool that I use with patients and I train patients on, but now, one of the silver linings, I know there's not many, but one of the silver linings I think that has come out of this pandemic is that there has been a wealth of resources made much more available to people for things like relaxation and meditation. And that's the next tool that I'm going to talk about. I've seen tons of commercials on all the different news channels for the app Calm or the app Headspace. And I would encourage you to try those out. I think many of them are free for the first 30 days. Meditation and relaxation has become much, much more accessible. So it doesn't just have to be this kind of hokey thing that only a few people do, but it's become very much more practical. And we've seen a lot of research support the benefits of relaxation. Part of why we use relaxation with chronic pain is, one, very naturally, to live with chronic pain. If you think about that fire alarm example I said is crazy making, it induces significant anxiety. What we have found through research is, if you've heard of that fight or flight reaction, it's a reaction that happens when we perceive danger. Our bodies goes into this fight or flight mode, and a lot of different physical things happen. Our muscles tense up, our blood flow changes, our blood pressure changes. Um, we have learned that people who are in chronic pain are often in a chronic state of fight or flight. That's part of that anxiety response. And so not only is that uncomfortable, but it also has some negative health benefits to be in that chronic state of fight or flight. It's not good for your heart. It's not good for your blood pressure. It's not good for the rest of your muscles that are tense all the time. So one of the reasons we want to engage people in relaxation and meditation is to move people out of that fight or flight response and into the relaxation response. Another reason that we engage in these type of exercises is because sometimes things like visualization or breathing can actually cause the pain to go to the background a little bit. It could create a change in the experience of pain. Some people say it decreases the intensity. Some people just say it changes the experience of it. And some people say that by focusing so intently on something in a specific way, then the pain more easily goes to the background. If we have enough time at the end of this session, I'd love to take you guys through a brief exercise. If not, then I'm happy to provide the library maybe with some resources of where you can access them. But just to give you a little bit of a sense of some of the different types of ones. Progressive muscle relaxation is where we go from our head down to our toes, or vice versa, our toes all the way up to our heads, and we progressively tense and then release the muscles. And what that does is it really gets us focused just on our body, and it really helps us understand and get intimate with what it feels like to tense our body and tense certain muscles, and what it feels like to relax them. So it helps us to really learn to release a lot of the tension that we might carry in our body from dealing with pain for so long. Autogenic training is using imagery and heat and cold to create different sensations in the body. So you use a combination of imagery with these heat and cold references to create different experiences. Some people feel like warming exercises are more soothing. Some people feel like cooling exercises are more soothing. Visual or guided imagery can be done in a number of ways. Sometimes I take people to a scene like the one that you can see here, this kind of serene, open water kind of scene, or a peaceful scene, a scene that they find really soothing to just create that relaxation. And then sometimes we use imagery to actually delve into the pain. And I'll have a person close their eyes and zoom into their pain almost like they had a camera in their mind. Really observe how it feels and try to create an image that they associate with the pain. So for instance, if a person has a neuropathic type pain that creates kind of like an electric sensation, they might say it feels like I have all of these wires kind of in a tight ball that are all shorting and open circuits, and I could see these sparks coming out of these wires. And what they do is they hold that image for a few moments, but then we work to change the image. And we might change it in just a subtle way, like we might imagine a blanket kind of being placed over that ball of wires to just, stop the sparking from happening. Or we might get really creative and try to change it in intense ways, like imagining that the rubber that coats the wire kind of liquefies and ends up sending this wiry ball into kind of like a liquid rubber puddle. And it allows people to get as creative as they want to try to shift the sensation of the pain. Diaphragmatic breathing is exactly that. It's just breathing in this other way. Often when we're in chronic pain and we're in this chronic state of stress, we do a lot of the shallow chesty breathing. If when you breathe, your chest is moving up and down, you are engaging in shallow chest breathing. Ideally, in order to get the deepest breath and to engage in breathing in a way that often relaxes us, you want your abdomen to be going out and in. So when you inhale, you want to push, you could sometimes push your hand on your stomach, and you want to feel as you inhale, your abdomen push against that hand. And then as you exhale, feel that pressure relieve. Mindfulness is kind of a buzzword right now. The two things probably from this talk that you see a lot in the media of are the opiate talks, and then mindfulness being another thing that is widely talked about. And there's a lot of misconceptions about what mindfulness is. For the sake of this, the way that I think about mindfulness and mindfulness-based meditation is cultivating the ability to be present without judgment, to observe our experiences without judging them. And in terms of being present, we often tend to be reflecting on the past or projecting into the future. And with mindfulness, we're trying to get comfortable in just staying in the here and now. It is much easier said than done because our minds are very, very stubborn and want to go to all these different places and want to bounce around all over the place. So it takes a lot of practice, but the way that we practice it is we sometimes just focus on something that we do ordinarily, but focus on it in a different way. So for example, one of the things that I often will do to teach mindfulness is have people eat something like a raisin or a candy, but let's say a raisin, for instance. And typically, if I gave a person a raisin, they just eat it probably in 2 seconds and not notice much about it. But to eat mindfully means to observe, let yourself observe that raisin as if you've never experienced a raisin. You never even knew what a raisin was. And so you tune into the way it affects all of your senses, how it feels, the weight of it, the texture of it, the smell of it, before you even bring it to your lips. As you bring it to your lips, you observe maybe the urge you have to bite it. You observe the way that the saliva is building up in your mouth. And then as you begin to put it in your mouth and move it around, you notice all the different sensations and the different tastes and the way it feels against your teeth versus the way it feels against your tongue. So you let yourself really experience it in this new way. Some people think that mindfulness is just seeing the beauty in things. And sometimes when we're mindful, we do appreciate the beauty more so than we would if we weren't being mindful. But it's not really seeing the beauty in things. It's allowing ourselves to experience it enough with all of our senses without judgment. So part of it might be as you're experiencing that raisin, you might notice a really bitter taste that you don't like. That doesn't mean you're doing it wrong. It just means you're paying attention, and instead of getting caught up in judging yourself for experiencing in that way, you just stay in this place of being very curious and very open-minded. Sometimes I say it's like being, if any of you have children or grandchildren, it's like being a 2-year-old as you experience things, like seeing things for the first time and experiencing things for the first time. Or you could imagine being an alien, coming to this planet, what it would be like to experiencing these things. So they might not enjoy everything and feel like everything is beautiful, but they'd be observing everything with this openness and this curiosity. And finally, hypnosis is something that you often go to a practitioner for, but there are a number of self-hypnosis activities that you can engage in. And the real idea behind hypnosis is not like, doing something silly and having your eyes move back and forth and turning into a chicken on stage or something, but it's really about opening yourself up to the power of suggestion. And with various exercises, sometimes you can allow yourself to open up to suggestions like, my life can still be good. I can still meet people. I can still enjoy good quality. I still have a number of things that I can do, even though the pain has taken things away. And so through various exercises, you can sometimes open up to those suggestions. Cognitive behavioral therapy is the bulk of what I do, and it's kind of the principle behind a lot of the therapy that I do. But there are a lot of CBT type things that you can do on your own. And cognitive behavioral therapy, for those who aren't familiar, it stands for, stands for cognitive behavioral therapy, but it is based on the notion that our thoughts and our behaviors and our feelings are all interrelated. So that if we made a change to one, then in turn, the other two would change. So for instance, if when you are in severe chronic pain, I mentioned for many people, they become depressed, right? So as a person is depressed, they might be more likely to have thoughts like, my life is never going to be the same. I'm never going to be able to do anything. I'm never going to amount to anything. My family's never going to understand what I'm going through, right? They might have a lot of thoughts like that. And as a result, they might end up withdrawing from social things. They might end up avoiding certain interactions. They might end up being less likely to engage in certain activities, right? And then, as I had mentioned before, it fuels the cycle. If we can shift one of those things, if, for instance, we can change the thought and have the person saying, well, life is going to be much harder with chronic pain, but there's still a lot I can do, then all of a sudden, that is going to affect their emotions. They might not be nearly as depressed. And without being as depressed and with being a little more hopeful, they might be more willing to approach things. So in cognitive behavioral therapy, we try to target one of these and then in turn change the system. Some of the different thoughts that trip us up or negative thought patterns that we get into have different names. We call them thought distortions. It's not the best name. It's not my favorite name, but basically it just means like the maladaptive thoughts that we end up having. And this is not just in the context of pain. We all have different thought patterns that are less helpful than others. I always say in New York, I think we talk with like much more colorful language. And so we engage in distortions without even realizing and without us it impacting us that much. You know, if people come in and say like, oh, it's so hot, I'm going to die, you know, that's like just, I don't know. I always think of that as kind of a more New Yorker type of thing. And it's a distortion because of course you're not going to really die from the heat, right? But that kind of distortion is kind of harmless. It's just a matter of speech and it's not a problem. But if we engage in certain ways of thinking about things over and over and over, it ends up creating a problem for us because we end up kind of believing our own narrative. And so, for instance, if a person, as I said before, convinces themselves, I'm never gonna, let's say this is a person who developed pain and was single, and they say, I'm never gonna be able to date anybody. Never gonna, with this kind of pain, I'm never gonna be able to date anybody. And they say that over and over and over to themselves. They're gonna believe it. And as I said before, they're gonna stop trying, right? So one of the steps that we can take to try to help ourselves is to try to gain insight into what our thought patterns are. And for the audience here, I imagine you either are dealing with pain or are interested because you have a loved one who's dealing with pain. What you can do is try to tune into the way that you think about yourself in relation to the pain, or the way that you think about your pain in relation to how it affects your relation to others. And just try to tune in to notice how many of the thoughts seem like how many of the thoughts are absolute realities, you know, objective realities, and how many of the thoughts might be skewed or what we call these distortions. And one of the ways that you can kind of try to tune into this is you can familiarize yourself with the different categories of distortions. So here I list a few of them. If you're interested in this as a modality, then I would recommend you just Google cognitive distortions. In most lists, there's about 10 of them. And the more familiar you are with them, the more you can catch yourself in the act of doing it. So for example, catastrophization or catastrophic thinking is assuming the worst case scenario is going to happen. I'm going to the doctor and I know he's giving me this injection. It's definitely not going to help, right? Nothing's going to help my pain. So that's imagining the worst case scenario. Magnification or minimization, both of those are problematic. And so magnification is making something much bigger than it is. Minimization is obviously the opposite, making something much smaller. The way that we see this in pain is often people will magnify the problems and they'll minimize their successes. So I will have a patient, the other day I had a patient who, after not exercising for probably a year and a half, walked 2 times and came in, casually mentioned that, and spent most of the session talking about how she couldn't walk the 3rd time. She tried, but she couldn't do it. And so I stopped her and I said, wait. You're focusing only on the time that you weren't able to do it. And what happened is you lost your huge success. You know, it got lost in the midst of this. And we know that that happens because inadvertently what it does is it kind of perpetuates the disability. So we really want to kind of observe when we're doing that kind of thinking. All or nothing thinking, or sometimes we talk about this in black and white thinking. I will see this often where people will say, if I can't do something the way that I used to do it, then what's the point in doing it at all? I remember I had a patient who was an artist, and a big part of her art, it was abstract art, and it was art that she had to be very active because it was big art using big materials. And with her pain, she wasn't able to lift these materials and move around in the same way. And when she saw me, she had given up art altogether. Because she said, if I can't create what I create, what's the point? And so what we had to try to do was help her gain awareness into that way of thinking and how it was really inhibiting her life, and help her move to a way of thinking where she was able to say, okay, I'm really disappointed that I can't do this kind of art, but there's still a whole range of different types of artwork that I can absolutely still engage in. Mind reading is assuming what another person is thinking. We see this a lot of times when we're thinking about how other people might think of us as it relates to our chronic pain. People are going to think I'm a loser. People aren't going to believe me. He doesn't trust. We see this sometimes with a doctor. He doesn't trust that the pain is real. A lot of times when people come to me as a psychologist, they think they've been referred because the doctor doesn't believe that their pain is real. And one of my first interventions with them is to challenge that distortion and help them understand, no, they were referred to me because these methods have a lot of efficacy, almost just as much as the medications do, in treating pain successfully. And the last one, not the last distortion, but the last one that I mentioned here is emotional reasoning, which is I feel, therefore it is. And so I feel disabled, therefore I am, and I can't do anything. I feel like a loser, therefore I am a loser. And certainly we could understand the negative ramifications of this. On this side, um, these are the ways that we can challenge. So once we gain awareness to what these thought patterns are that we're engaging in that are not helpful to us, what we then have to do is figure out what to do with them, right? So how do we change these thought patterns? And there's a number of different ways. These are some of them, and I just articulated some of them. But sometimes just by journaling our thoughts for a short period of time and recognizing, oh, these are distortions, that corrects it in and of itself and moves us to a different way of thinking. Just the labeling of the distortions sometimes is a sufficient intervention. Another way of challenging this is to say, okay, what's the evidence to support this? What's the evidence to support that I can't engage in any kind of other artwork, right? I will sometimes say, if you were in the courtroom and you had to argue this case in front of the jury, would you be able to convince the jury of your argument, right? The double standard method is one of my favorites because I think we are all often blinded in our own perspective, but are able to see more objectively for other people. So in this challenging method, we take whatever the statement is that we made, or we take whatever thought it is that we observe seems to be a pattern, a negative pattern, and we say, okay, if this was my spouse saying this, if my spouse said, I'm a loser, I know I'm a loser, would I let him get away with it? Or would I let her get away with it? So you try to take what you would think about or how you would react if somebody else says that and then apply it to yourself. For the black or white way of thinking, this thinking in terms of shades of gray is a helpful one where we take one way of thinking on one end of a spectrum and we kind of recognize, okay, this is one extreme way of thinking, and then we try to create the other way of thinking. What would be the opposite of this? And then we recognize that probably the reality is somewhere more in the middle, right? So if a person was a runner and they're saying, if I can't run a marathon, then I don't want to exercise at all. Then that would be at one end of the spectrum. If I can't run marathons, then I can't exercise at all. The other end of the spectrum was, I can exercise all the time, no matter what, right? Somewhere in the middle is, there's a number of things that I can't do because of my pain, but there's a number of things that I still can do, right? And that's really where you get closer to a reality as opposed to just a distortion. The final one that I always like to think of when all else fails, sometimes it's helpful to just say to yourself, what is the benefit of me thinking about it in this way? Even if there's some reality to it, is it helpful to me to think about this in this way? And I think often you will recognize you're hurting yourself more than helping yourself by thinking of things in certain ways. outside of cognitive behavioral therapy is sometimes just strict behavioral therapy, where we just look at the way that we're kind of interacting with our environment and see if there's little changes that we can make that might help us. So for example, with chronic pain, one of the things that we know sometimes happens and what we've learned is that when it is possible, it is better to have medications administered on the clock as opposed to as needed. Because sometimes what happens, if a medication is just administered as needed, what ends up happening for many patients is they get to a point where the pain gets pretty bad. They need to get to that point for the pain to get pretty bad to then say, oh, I need, and it fosters a dependency on the medication. And also, it doesn't give a person a chance to kind of develop their own coping tools. So if you can, and not everybody can, and sometimes you end up having a mixture of the both, but if you can switch to taking medication around the clock, so you take medication at set periods of time, then instead of creating a pattern where I'm in pain, I need the pill, it's I take these medications to manage my pain, and then I have these other techniques that I can also use to help me if pain flares. So just something to think about. For those of you who maybe have family members with pain and you're here and listening to this talk because of that, something to also think about is how the family system or the system that that person exists in responds to that person's pain. And so, for instance, we know that there are some family systems where that person gets tons and tons of attention and support and coddling when they're exhibiting pain behaviors. And then when they seem okay, everybody's so psyched and feeling so relieved that they don't get nearly as much attention. And what that inadvertently does is it reinforces pain behavior. And with chronic pain, pain behavior is not so helpful. You know, if you're experiencing acute pain, you put your hand on the stove, that grimace is natural and it's helpful because, you know, and that reaction is helpful. But if you've had pain for 10 years and you're walking around limping and grimacing and having a lot of pain related behaviors, it's not necessarily as helpful. And so if the whole family system is only reinforcing that behavior, then it is kind of condoning it, right? It's not that the pain isn't real and it's not that we don't understand why those behaviors happen, but we want to try to move a person to wellness behaviors. We want to provide a lot of positive reinforcement and encouragement when that person gets up and takes a walk, and when that person calls a friend, and when that person, you know, engages in some kind of hobby that makes them feel really good. So you really want to pay attention to the system the person's in and kind of what ways you might be inadvertently reinforcing negative behavior and try to shift to reinforcing the positive behaviors. And then finally, just in terms of, you know, when I had started with setting goals, and that's all well and good, and certainly if you set the goals in this very small stepwise fashion, it should be doable. But the other concept, which is a behavioral concept that is really crucial to often put into place when you're setting goals, is the concept of pacing, which is really an adaptive approach that I always think of it, it's like the tortoise and the hare. The tortoise always wins, right? So pacing is the concept of instead of trying to just do something full out, as you maybe formerly had, or because you have a lot of motivation, you kind of want to roll with it, you try to push yourself to some extent while also maintaining awareness of your body. So what it often looks like is doing a little and then taking a break, doing a little, taking a break. And so it ends up kind of diminishing what the negative consequences could be if you pushed yourself too hard. And it gives you this feeling of accomplishment, which reinforces the activity and then makes it more likely for you to motivate to keep setting goals. The opposite of pacing is what we call the push-crash cycle, and a lot of people get into this where when they feel good after, let's say, a period of really feeling lousy, they feel like this renewed sense of energy and they say, oh my God, I'm going to clean the whole house. I haven't felt this good in so long, so I'm going to clean the whole house. And they push, 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 push. But because they haven't been active in so long, forget whatever their chronic pain is, the rest of their body conks out because they've experienced so much depletion of muscle tone and atrophy. And so they crash, and then they're out of commission for an extended period of time until their body recovers, and then they end up doing it again. They feel better, and then they push and crash. So pacing is really a good alternative and something that I encourage you all to try. I'm just aware of the time. I know that it's 3:04. I have the ability to stay a bit longer, but I just wanted to check. I don't know if the moderator is on. Are you there? I can't hear her, but okay, I'm going to keep going. I'm assuming that they will stop me if I need to. Oh,
Hey, Madeline. Sorry,
hey,
my
that's
my
okay.
headset wasn't working.
That's
Um,
okay.
yes, maybe you can go on for about 10 more minutes, and then we'll leave time
Perfect.
for questions.
Perfect. Yeah, I think I only have 2 more slides. So that's perfect. I
Beautiful.
think I'll only go on for about 5 more minutes.
Thanks.
Sure. So communication is certainly another tool that can be really, really crucial in this. And communication can be crucial in terms of communicating with clinicians. As I started out saying, pain management of chronic pain has to be a collaborative process with your doctors and clinicians, and so there has to be effective communication between you and your clinicians, but certainly in your lives outside of the clinical realm. um, Good communication skills can mean the world of difference in terms of how people are relating to you and your pain. And there's always kind of a fine balance. I know people always struggle with not wanting to bombard people or burden people with their pain, but also feeling like this is such a real part of my life. How can I not talk about it? And I think that there's no great formula for how to balance it, but I think if you go in with the notion of trying to maintain that balance, and trying to be as authentic as possible in your experience, that's usually a great starting point. Another key thing is assertiveness, right? Often, when you have lived with chronic pain for a long time, you end up kind of feeling like a victim to the pain because in some ways you are, right? The pain has had a hold of you for so long. And when you feel victimized for so long, sometimes you feel like you lose your voice. And your voice can be your most powerful ally in living with chronic pain. So um, it's very psych speak kind of, but there are some of these formulas for kind of really checking in to make sure you're being assertive. And the key sentence is what I put here. I feel blank when you blank because blank, right? So I feel hurt when you um, uh, when you don't include me when you're doing activities because I still really want to be part of our family, right? And so you're starting with what you feel. You're saying it in a respectful way, recognizing that the other person has their own needs and their own perspective, but you're letting them know what it is that made you feel that way, and you're giving them a little insight into why you feel something, right? Often, in order to do this, you have to tune into what it is that you're feeling. But as you can hear from all of these tools, a lot of this is about gaining self awareness about our thought processes, self awareness about our emotional processes, self awareness even about the physical aspects of our pain, right? And so I'm hoping that as you're more self aware, assertiveness becomes easier because the more in touch you are with how you feel, the more able I think you feel to convey that to others. Um, Speaking of conveying, it's often important to sometimes we inadvertently convey things that we don't mean to. Sometimes in clinical encounters, this happens. I know when people end up kind of freezing up, either because there's a little of the white coat syndrome or just because they're getting bombarded with a lot of information from the doctors, but they end up either conveying something that they don't mean to, or they don't convey anything at all. And you might end up leaving a doctor's appointment feeling like, I didn't get to ask this, I didn't get to tell them about this, I didn't get to say this. So one of the best ways to convey what you intend to convey is write it down. I encourage everybody to write down notes before they go to a doctor's appointment, just so they can stay aware of the key points that they wanted to bring up. Not a novel, but just, a couple key points or key questions that you wanted to make sure that you asked. Another way to make sure that you're conveying what you intend to is to stay focused on your experience. So using I statements rather than you statements. So I feel really misunderstood. I feel really hurt. I feel really left out, as opposed to you always leave me out and you don't ever understand me, right? And the reason that this is not only because it assures that we're conveying what we mean to, but it also kind of makes it much more likely that people will hear us. If we end up going at somebody with you statements, the natural instinct is to just get defensive, right? So if you focus just on what you're going through, then whoever is in your life is far more likely to be able to hear your experience, whether it's an emotional one or a physical one. And the last piece is, if you want to be heard, then it's really important to hear others, right? So if you here listening today are the people with pain, then I'm sure you want others to understand what you're going through, but those around you, they also have a lot to deal with in terms of when you love someone who's in pain, it creates a lot of helplessness. It's awful to see somebody that you love in pain. And so they might not be experiencing the physical um, complications of chronic pain, but they might be feeling this burden and this weight of wanting to help you desperately and not knowing how, and not knowing how to deal with that and manage it, and struggle with knowing that you're in so much pain. And so I always encourage everybody, to try to make sure that not only you're doing things that are going to make it likely that you're heard, but also doing things to make it likely that you hear others. And a good thing to do to show somebody that you're actively listening is to just offer simple statements of reflection. You sound really upset about what happened yesterday. I can hear that you sound really overwhelmed. I can hear that you sound like you're a little bit frustrated after, I wasn't able to join the dinner yesterday because my pain was so bad. So these are, obviously you don't have to follow the formula, but it's a good way of remembering how to do this. And the final slide is just one that is essentially something that is helpful to any type of condition, which is just some of these healthy living approaches. We know that there's been some research on nutrition and exercise and sleep, and how beneficial maintaining good nutrition, trying to get as good a sleep possible, and exercising can be for living with chronic pain. And as I said before, this is true for any condition, right? These are things that we should all be doing regardless, but these are things that are especially important, and I put it a slide here because these things kind of fall by the wayside for a lot of people with chronic pain. I have tons of patients who are in bed all day because they're in pain, and they're laying down and resting all day, and so then they're up all night and their clock gets all screwed up. I have patients that eat in bed, and so then this concept of stimulus control, which is one where the power of association is very strong, and we really are intended to associate the bed with sleep or sex sometimes, but um, as soon as we break that association and we start eating in the bed, or doing work in the bed, or watching TV for endless hours in the bed, then when we hit that pillow, when it's time to go to bed, our brain's not thinking, oh, here's the place that I sleep. Our brain is thinking, here's the place that I'm going to enjoy a lot of activities, and it's much harder to fall asleep. So we really want to try to pay attention to that, make the bed a sacred place as possible. If you need to rest outside of sleeping hours, try to find another comfortable place that you can rest. If you don't have another comfortable place you can rest, you can shift your positioning so that there's like the resting positioning and the sleeping positioning. Nutrition often falls by the wayside because sometimes when we're in pain, for a lot of my headache patients, I know they talk about that there's certain cravings. When a lot of patients have migraines, they crave carbs. And so they kind of overdo it with carbs and sugary foods, and then their bodies end up having this kind of uh, like breaking point where they feel maybe a little bit better from all of that, but then there's like a fall off when the sugar high ends. And so I think just trying to have a fairly well balanced diet, trying to eat, meals throughout the day can be really helpful, as opposed to finding ourselves in unusual eating habits. We also know that there's certain foods that tend to have some natural um, um, anti-inflammatory potential. And so I don't have that list of foods, but I know that there are plenty of lists that you can go to, but there are some foods that you might look to that might have some natural anti-inflammatory properties. And finally, exercise. As you've heard from all of my examples in the way of thinking, exercise is absolutely one of the things that falls by the wayside because, let's face it, a lot of people say, when I exercise, it hurts. And I don't want to hurt more than I do. And I certainly get it. But there's a whole range of ways that you can exercise. There's modifications that you can make to exercise. And don't forget, even though initially you might have a lot of pain when you start exercising. Some of that pain is soreness because the rest of your body has become deconditioned. There's a big difference between pain and soreness. And once you get over the hump and start making it more of a consistent part of your life, the benefits of conditioning your body, sometimes strengthening the rest of your body gives you a better structure to support the rest of your body. It could sometimes decrease your pain. We also know that exercise releases endorphins, which can help mood and can act as natural pain killers. So it's often just getting over that initial hump and trusting the process and going gradually and using pacing that can help you make exercise still a part of your life. Um, and this is just something I like to end with. The greatest revolution of our time is the knowledge that human beings, by changing the inner attitudes of their minds, can transform the outer aspects of their lives. And you can see here, this person looks how I hope most of you could look with regard to that pain metaphor in the car, that this guy is definitely behind the wheel. He's smiling and he's got his passenger buckled up and absolutely quieted. So, I hope that with these strategies, some of you feel like you're able to reclaim the wheel and get back some control in your lives.
Thank you so much, Dr. Gittleman. Let me end the
Sure.
recording here so that we can open it up to questions.
Sure.